Well, in August, the CDC strengthened its recommendation for women to receive the COVID-19 vaccine during pregnancy, and that means that the vaccination is recommended for all people now 12 years and older, and including people who are pregnant, breastfeeding, or trying to get pregnant or might become pregnant in the future. And with that in mind, we're going to talk to a couple of maternity experts today.
Great.
So first up on the conversation here is Dr. Sarah Massey.
Hi, nice to see you.
So before we dive in here, why don't you just tell us a little bit about yourself?
Yeah, so I've been practicing here in Des Moines, or West Des Moines as well, for about 8 years, and deliver at MercyOne, as you said, as well as MercyOne West. We have a private patient population out in West Des Moines that we care for with 6 female providers.
We've been talking a lot about the safety of vaccination when it comes to the pandemic. And pregnancy has definitely been a hot topic, even in the last week or so. So let's get right to it, Dr. Massey. In your opinion, is getting the vaccine safe for pregnant women or people who want to become pregnant?
You know, certainly from the beginning, I was a proponent of it, but it was difficult to convince pregnant patients that it was safe. And, you know, as a provider who had been recently pregnant myself, I definitely understand their precautions. However, there's increasing data out there and increasing support that says, yes, indeed, this is safe and recommended in pregnancy. Some of the most recent data has come out of the CDC, starting way back when they first started giving vaccinations. They began collecting information from people. This is all self-reported information. So that was through their Be Safe study. And as of July, they had over 139,000 women who self-reported pregnancy. And through those women, they collected information on things like miscarriage, complications, both with baby and with mom. And out of all the information reported, they had no concerns and nothing over the baseline risk for pregnancy was seen in those moms and babies. So I think that gave stronger support and ultimately came out with the CDC's recommendation to go ahead and recommend that and recommend vaccination in pregnant, lactating, and pre-pregnancy.
Have you seen, I mean, when the women are not getting vaccinated, have you had any patients that have had COVID, and what were the effects of that on the mama and the baby?
Certainly. You know, we've seen COVID-19 positive pregnant patients throughout the pandemic. We had a little bit of a lull during the early summer months when it seemed to have quieted down here in Iowa. And now we're seeing a resurgence again now with most likely the Delta variant. And we've had patients that have required just some supplemental oxygen, but we've also had patients that have required ICU admission and have had more severe illness. And I would say, you know, from a clinical standpoint, that these most recent infections in pregnant patients that we're assuming is most likely the Delta variant tends to be more severe. And these patients have more severe complications. And when you look at the research, we know that pregnancy itself is a risk factor for more severe disease with SARS-CoV-2. So they provide about a 3% increased risk of being admitted to the ICU. And usually that means you're pretty sick. You're requiring either a ventilator or some high flow oxygen, and you're having a lot of difficulty breathing. And there's even a 1.7% increased risk of death with COVID-19 in pregnancy. And that's just using pregnancy as a risk factor. That doesn't include these moms that already have perhaps diabetes or high blood pressure or obesity, which is even compounding that risk even further. So certainly we're caring for these patients. We're seeing them. We're seeing a resurgence here in Des Moines. And you know, that just gives me even more pause to sit with these patients and really recommend that they consider vaccination.
Can you tell us a little bit about what those discussions are like that you have with your patients, and what do you cover to make them feel a little better?
You know, initially I kind of try and gauge what they know about the vaccine and how open they are to it, because that really kind of drives how we discuss it. I have some patients that are immediately turned off by the thought of even bringing it up. I have others that just don't feel like they know enough, and they really just need a physician to talk to them about the risks and what our recommendations are. And I feel like as a physician, we can really make a difference in somebody's decision to vaccinate. And so in reality, I just give them these points that we've been talking about, the fact that the data is there. The CDC has now recommended it. The FDA has completely approved, not just emergently, but approved the Pfizer vaccine in folks over 16. And that, the safety data is there. You have to think about your risk benefit ratio. In the past, when we could self-isolate at home and everyone was wearing masks, maybe we were all a little safer, but without masks being mandated in Iowa, especially in Polk County, with our kids going back to school, it just really opens up the door for, these variants and for COVID to enter your home. And there's only so much you can do to really prevent that. And again, it comes back to, we know that the vaccine is safe. We know that the benefit at this point outweighs, certainly the risks of COVID in pregnancy. I think, with anything, people go to the internet for research. And certainly with COVID-19, there has been a surge in social media of all kinds. And there's a lot of misinformation out there. And many times people are also just reading headlines and they're not delving into the actual literature behind it. And headlines can be very misleading. So, it's all about your sources. And in reality, you need to go to the direct source. You need to go to the FDA, the CDC, the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine. All of these sources will support the recommendation for vaccination. I think the one thing that people are still hung up on is vaccination pre-pregnancy. I'm thinking of getting pregnant this year. I'm thinking of getting pregnant in the next 2 years. There's a lot of misinformation, especially in social media and on the internet, about infertility in pregnancy and infertility caused by the COVID-19 vaccine. And I just want people to know that the data shows there is no concern for the COVID-19 vaccine causing infertility or interfering with that in any way. I think a lot of that is bad information and misinformation. And, why not take the concern of vaccinating in pregnancy away and go ahead and vaccinate before you get pregnant, because then that's one less decision to make, in my opinion. That doesn't mean that we won't be boostering every year or whatever it may end up looking like. This could end up like the flu vaccine, where we're changing things up on a yearly basis, but by then we're going to know more and more information. So I just encourage patients that are considering pregnancy to go ahead and vaccinate now, because that's one less thing to worry about once you become pregnant.